Sitting on this committee, I have seen countless bills come forward deciding what we're going to prioritize and where we're going to take money and where we're going to spend money and how we're going to allocate revenues. And I started getting contacted about this bill. Didn't really know much about it in the beginning from constituents pretty early on. And I asked OLR to pull me background information on what the state of Connecticut has done with the several hundreds, if not more, millions of dollars that we have gotten in relation to the smoking settlements. We've done nothing. We've done very nothing. I think we did 30 million over the last 20 years. We've dedicated to smoking cessation when we're receiving over $130 million a year. Instead, we're padding the general fund to this gets back to the last bill that we did. We're getting money for one thing and we're saying, nope, we're going to put it in the general fund instead of putting it where it belongs. And that's problematic to me, whether it's the special transportation fund, whether it's a clean air fund, whether it's smoking cessation. This money came from settlement because of the wrongdoing of the tobacco industry. We're now seeing money coming in from the opioids settlement for wrongdoing by pharma. And I think it's disappointing that we say, in this case, we're going to sweep it and use it for everything but what it should be used for. But yet we still see bills coming through this legislature for vaping, for nicotine addiction, for the impact to children and everything else. But we've decided that no, $4 million is good enough out of $130 million. And I find that disappointing. I find it an abdication of our duty. If we've gotten this money from a settlement that is supposed to be used to help healthcare costs, can we think about the healthcare costs associated with smoking and vaping and everything else? But again, we're not focusing the money where it should go. We're sending it instead to the general fund to do whatever with. So I'm strongly supportive of this amendment. And I ask people to listen, unmute, think about it, stop multitasking, and think about the fact that we're getting $130 million a year to stop cessation of smoking and nicotine products. And instead, we're dumping it into the general fund. If this is a priority for us, it should be a priority for us. That's kind of how I live my life. If it's a priority, you find a way to make it happen. If it's not, you talk about it. So my case, strongly supportive of this amendment. And I ask that everybody actually think about what we're doing here. We're taking $4 million out of 130 to address a problem that has long-lasting lifetime benefits, health benefits, economic detriments, all these things. And actually say, let's do our job and put the money where it should be. Thank you very much.